So we're going to start with Ann Harris, and she's going to go through our learning objectives as well as just kind of that general overview, and we'll go from there.
Great, thanks, Maya. Hi, this is Ann. For those of you who went to the Baylor conference, they did present, and it had just been released, the clinical report from the AAP, AAFP, and American College of Physicians. And so we thought we would take this November opportunity to give you just some of the highlights of the report and sort of spark your interest, and hopefully reassure you that not a lot has changed, but there's some new information that might be helpful. And if you can, just keep in mind as we go through this brief overview, and we'll be going pretty quick, that if anything sparks your interest, you're welcome to ask a question like Maya said in the chat box, or make a note and ask it at the end, or contact us later, because we do want to hear if you want more information. But we thought this would be a great way to just get people familiar with what's in the report. So in the next slide, it just shows the intro slide from the Baylor presentation. So those of you who were at one of the viewing sites, either in Madison or Milwaukee, may have heard Patience White give more details about this information. So we borrowed a couple of her slides and created a few more, and we're really trying to bring what she was saying about this report into relevance for what we're doing here in Wisconsin. So the clinical report. Oh, and I didn't share the author slide, but again, you should all have access to the report with the complete set of references, as well as the contributors to that report and the co-sponsors. But the main point of this report is that the tenets and algorithm for youth health transition have remained unchanged. So the report itself focuses more on updating the literature. So the report was released before in 2011 from this joint group, and now has updated. They reviewed the literature from 2012 to 2017, and there has been some literature published on different ways that we are providing evidence for what works for youth health career transition. But the findings confirmed that we still need to focus on this, and I'm going to share just a little bit of one piece of data from our national survey that continues to show that healthcare transition is an ongoing need to support and improve. Again, the report confirmed the guiding principles, and they're outlined in the report, and also the 6 core elements from GOT Transition, who helped to co-sponsor the report, have not changed at all. And then one thing that did appear, and we knew this in Wisconsin because one of our participants, Judy Stike, had done a fairly extensive literature review during this time as well, is the increasing and evolving focus on adult providers as needing to partner with them to focus on their education as well as engagement in the process. I think the message is pediatricians have kind of got the message and are doing what they can, but we do definitely need to involve more adult providers. The rest of the report, it gives quite a bit of detailed information on some implementation strategies, and in particular, for those of you who got a copy of the report, on page 7, there's ABC examples of different policy statements that different types of practices can use. So if you're looking for a policy like how to introduce a transition policy to families, there's some really good examples there. And there's some other discussion about how to use quality improvement methods in practices. So those are more details that you might be interested in pursuing. A little bit later in this presentation, other team members are going to talk about special populations, education and training, and ways to approach funding challenges that are also mentioned in more detail in the report. In terms of research, they are recommending that we spend a little more time looking at the whole transition package, that transition doesn't equal either the end result of transfer or the planning process alone, but it's a 3-part process of planning, transfer, and then integrating the young adults into the adult practices. So those are just, there's research on pieces of it, but there really needs to be more research on the integrated approach. So those are the highlights, and we're going to go into just a few details from the report. So One of them is this slide on the combined data from the National Survey of Child Health. And one of the sort of surprising things was that they've changed the way they're measuring successful transitions. And so the actual numbers for who's reporting, getting planning guidance from HCPs, and is lower than what we used to use as we were saying about half the kids were getting support for transition, but they're focusing the measure just on what they're getting from the healthcare providers. So the numbers are a little bit lower, 17 and 14% if you look at the combined data, but I also kept on this slide, it's from Patients White, that what they're measuring. So they're basing it on whether youth had time alone with their healthcare provider, and I believe these two numbers are the with and without special needs. They're looking at those who are gaining an understanding of the changes that happen at age 18, and they're looking at the shift in who cares for adults. So these are just the elements that they're measuring, but the numbers have kind of changed. If you start to see statistics that show that we're not doing very well in transition, it looks like we're gone backwards, but really they're just measuring it differently. In terms of barriers to successful healthcare transitions, these again, we know from some of our practices, but we also were affirmed in this report, which they looked at, and they list in the report both barriers for adult and pediatric clinicians, which are on the left, and for youth and young adults on the right. And some of them are very similar. So the communication and care coordination are similar. Under systems difficulties, that's where that comes in for youth and young adults, and it comes in the first and third bullets for adult and pediatric clinicians. So care coordination continues to be a problem. Big message there. They acknowledge and did affirm the fear of a new healthcare system, unfamiliarity with adult health providers and the way they practice as a barrier for youth and young adults, and not having enough support in planning for that transition. They also, again, this is where the adult clinician barriers also have been identified. So again, the report includes a lot more information for each of these different bullet areas if you're interested in that. And Maya, was that where I'm going to transition to you?
Yep, we can go ahead and I can take over from here. So again, what we were finding in the report is a lot of this is information that was not reiterative, but just confirming that the 2011 report has some really good information in it and just kind of adding on to that. So again, this was just to reaffirm that their 2011 AAP, AAFP, ACP clinical report, those ages that they had broken it out into seemed to really resonate with a lot of different groups who are working on this, on these transition efforts. And so they kind of kept those ages the same and just wanted to reconfirm that we were using these ages and that this is what they recommend as kind of the gold standard for age when you compare age for transition things. Again, whatever is developmentally appropriate for the child too. They also reaffirmed their 6 core elements approach and really looked at this as a continuation of their 2011 work, and reaffirmed that in working with several groups around the country that this is a tried and true method and that there's always room for improvement, but really these are the 6 core areas in which clinics as well as families and youth can really approach the transition process. So the introduction or discussion of a policy, tracking the progress of the individual, assessing skills, developing that plan prior to the transfer of care, then actually having the action of the transfer of care, and then the follow-up and continued maintenance. So in reading the report, we welcome you to go out and get it, and we don't want to go through it line by line, although we'd be happy to answer any questions for those who have perhaps read the report prior to today's conversation. But the main takeaways really were that this is unchanged and it still includes transition guidance for all youth and young adults. And they go on to encourage the action steps that they've used in the past, including in the clinic setting, discussing the transition policy with the youth and the family. Then the initiation of a transition plan prior to the actual action of transfer of care, and review and update that transition plan throughout the transition process to make sure that it really follows the child as they grow into a young adult, and then maybe start to take on a more independent role in their healthcare. It also goes on to highlight the tools and skills that they would expect people to have during that transition process, including their transition readiness assessment, which still is one of the best tools that I can recommend for any clinic who would be working with youth transitioning, is the assessment tool. Got Transition has also made it electronically available on their website, so you can go through and take the few assessment questions online as well as in the paper format. They also encourage independence through self-care skills, independent building, and the timely exchange of physician information. So that discussion between the pediatric environment and then the preparing of them to move to an adult care clinic setting, as well as the customizable tools that Got Transition offers in 3 different packages depending on the clinic setting in which you would be transitioning children and teens, young adults, and adolescents. They also encouraged the adult model of care, which they said was not part of their 2011 report. They didn't mention it there, but felt that it's a very crucial part of the whole transition process. And that idea is placing the young adult at the center of their decision-making and healthcare making skills and decisions, and having the supportive team surrounding them. So really also following that patient-centered or whole person care approach. And then there was a nod to some of the challenges that they're facing right now, but are also developing coding and billing and reimbursement for the transition process. And finally, really acknowledging that family and youth engagement portion. I've seen them doing great things with leadership, youth leadership groups, with family engagement, with outreach, and really making an effort to encourage other groups, other states, and specifically here in Wisconsin as well, our family engagement efforts towards making sure that youth and families are both involved in the transition process, so we're giving them things that make sense for them. Just to comment on the billing and services, because I think this is always a hard thing to kind of put anywhere in a report, is the payment and billing process. So where they talk about it, they're talking about that it's a continuing evolution. There's still some things that need to be figured out, but we do have, we had the added benefit and the support from Peggy McManus and Patience White as a presentation that they did at the beginning part of the year, February of 2018, where they actually run through some of the case scenarios on Got Transition, and as well as some coding and reimbursement tip sheets that they have available on their website. And they highlighted those in our learning community in February. So that's available in the archive, and we would encourage you to watch that presentation.
Thank you. So the report does call out some special populations in its additional area. One of those areas is young adults in particular. And so we have had the pediatric world has done a good job of saying, hey, you know, as these kids grow up to be teenagers, things change. The adult world really hasn't had a slot to put these young adults. And what we're seeing with the young adult population is an increase in risky behavior and a decrease in the use of normal health care. And so you have an increased risky behavior, low use of health care. They're not your normal adults. They're not your kids. They're something in between. And so we have to take that into consideration, that these are the kids that we are transitioning. So in addition to just the very fact of them being this age, you add into some additional areas of possible developmental, intellectual disabilities, medical complexity, mental behavioral health, and social complexity. What you end up with is the report pulls out some recommendations overall on how to deal with these special populations, including which is probably normal for you guys already, a flexibility in that transfer of care. Is that some of these young adults are ready at 18, others they're not going to transfer. You're not going to transfer that care until after they're done with college and they come back and then they're going somewhere else. That may be the transfer of care. And so there's an acknowledgement that there has to be more flexibility in the transfer of care. That for some of these kids, it makes sense to maybe transfer care between primary care to primary care first, followed by the transfer to adult specialties when those adult specialties exist. Looking at the condition specific acknowledgements that there are some populations that there are some condition specific transition guides that are available. Increased need for care coordination during this time. That there is a setup within the system for the adult providers to be able to consult with the pediatric providers, because there may be a lack of knowledge of some of the pediatric conditions that the young adults are bringing with them into adulthood. How do we help these peers connect with their communities? For our social complexity, this really is for those kiddos that have a problem with social complexity. This could be a really hard thing to do, because they're used to being around their peers. They have this natural social network, and then they're without it, and this can affect their health as well. And then one of the other things is to look at how can we better link to those community supports that are out there. So we're looking at linking to education, to independent living folks, and employment. I know that we believe that health is one of those foundational skills to success in life. And so one of the areas that we're looking at linking, that we're really working hard at linking to with the Youth Health Transition Initiative, is linking with our education partners and working at getting healthcare transition goals incorporated into individualized education plans, into post-secondary transition plans, so that we're using a current system of a very well-developed transition process that's in the schools, and helping them think, how does it look for healthcare transition? What does it look like for healthcare to be included in those transition goals? So that's embedded already in a system that is already going on. So we're going to continue that work in reaching out to the education program. But it's also one of those areas where, some of you that try communicating with schools, some schools communicate very well with the doctor's offices, others not so well. During this time of transition, it's important that we continue to build those good connections with the social resources such as education. Such as briefly, on some of the developmental intellectual disabilities and medical complexity. One of the things that you're going to see in mental and behavioral health conditions is probably getting into these discussions about who is making the decisions. And so are the parents aware of their options between guardianship, power of attorney, supported decision-making? Is the child's now young adult's condition such that they're going to be able to make their medical decisions one day, but if an event happens, they're not able to make that medical decision? So who's making that medical decision for them? Who all is involved in the medical decision making? And are the releases of information, does everybody have the right to make those decisions and have a right to all the information? So they've really pointed that out as well as something that needs to be taken under consideration. Along with the fact that even if the young adult is staying with a pediatric provider, that does not necessarily mean that those with medical complexity are going to remain with the children's hospital system. And so you may have the case where they need to be admitted as an adult into the adult hospital system, and they've had absolutely no foreknowledge of what that adult hospital looks like, is they're used to the pediatric hospital and the children's hospital. And so thinking through, where, if they are prone to hospitalizations, where are they going to be hospitalized next? And how can we make sure that's set up so that it's a smooth transition into the adult hospital world? And then making sure, again, that if there's the opportunity to set up young adults with culturally similar peers, we're talking some of these social complexity issues with racial minorities, immigrant, refugee populations, maybe some linguistic differences, LGBTQ, that there's some sort of coordination that they're attached, that they're given a resource that they can go to in their community. And that's again where the it's possible to call the regional centers, and we'll be able to help out with that transition with those resources, just like we can with a number of other of resources. All right, so unfortunately, the one of the things that the clinical report acknowledged is that we don't have any fantastic data on how much money that we save by having an effective transition process, but we are getting some data on what is some adverse effects associated with the lack of the healthcare transition process. And again, we'll especially call out those with chronic conditions. And so they just want to point out in the report is that they are seeing that those without a healthcare transition process more likely have medical complications, lower self-reported health and well-being. One of the big things that I think we see with children with chronic conditions, we'll see this as we look at special populations as well, is that not just in the healthcare system, but parents and families overall talk about the fact that they feel almost like when their child gets through the end of school and they're entering into adulthood and they have special needs, that there's almost this support cliff that they fall off, is that they have had a fantastic team around them with their pediatrician and their pediatrician team that has maybe been with them from birth and have watched this child grow. At school, they have an IEP team and some special education help. And there's all these social supports because kids are so dang cute. And then they become adults and some of those supports just go away. And some of the supports are harder to find. And so with the lack of a solid healthcare transition process for these youth, it's another area of that life that discontinuity of care comes in, is that it's not the same, it's different. Nobody prepared them for the change. And so we see dissatisfaction going. And if you don't have that continuity of care, what's going to happen? Increased hospitalization and ER costs, which of course result in higher costs of care. So these are some of the, like I said, we don't have this great shining rainbow of why this makes sense, besides the fact that we know it makes sense, but we're getting to have some evidence that it's harmful to not have a healthcare transition process in place, especially for those with chronic conditions. And so they do recommend education and training recommendations. One of them is continuing to set up learning modules for CME opportunities. And this is also where the Youth Health Transition Initiative can come in and help with some learning about transition. But especially, the forming of maintenance modules are, what does the pediatric condition look like in a young adult? And how could that be mediated between the two providers? Definitely needing to look at what are some enhanced training opportunities during residency, subspecialty training. Again, is that a lot of this report is focused on, okay, pediatricians are starting to get it. We're working on what does a good handoff look like? What does a good receivership look like? Who is going to care for these children for then the majority, hopefully, of their lives? And then also, like we talked about briefly before, incorporating the healthcare transition process into the educational system, not just at the high school level, but also talking with colleges, university clinics, the disability resource centers, school-based health centers, so that they also have the tools to provide the skills to these students. Because obviously what we're going for is the highest level of independence, the highest level of taking care of one's own health as possible, which takes knowledge about one's condition, knowledge about the healthcare system, knowledge of the insurance system as well. And so all those things wrapped in together to a successful healthcare transition.
Great, thanks, Tim. At this point, that kind of concludes the overall summary that we plan to do on the clinical report. I'd like to pause and just ask if there are any questions, any comments, any observations from the group. So while everyone kind of just mulls, I would encourage you to read through the report in its entirety. And